Dr. Martin Rutherford, certified functional medicine practitioner, chiropractor in practice since 1979.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And today, the title of our talk is going to be Marijuana and Chronic Pain. Is there a real benefit? This is a timely topic for us, although marijuana has been a topic for years, and there have been many groups that have been promoting the legalization of marijuana as medical marijuana. And we may not get into that whole controversy. We talked that we could do probably 3 presentations on this, but we're going to stick today to the actual clinical therapeutic observations that we've seen, the questions that we've been asked, what the research and what the literature says, and how we respond to it in our practice. It's kind of a timely topic for us right now because we are in Reno, Nevada, and if you're not in Nevada, you may or may not know that Nevada just passed marijuana laws that you can sell marijuana. There are marijuana dispensaries popping up all over Reno, and Reno's not a very big place. There's like 2 or 3 within literally like a mile of my house.
Yeah, exactly.
Like we live close together.
100 yards apart.
100 yards apart, right? We live in the same neighborhood, and then there's one popping up against outside of the Aces ballpark, which is our AAA team here, and so on and so forth. So it's quite the topic here, and as a result, and as I just discussed just 5 minutes ago in another presentation that we did, we do chronic pain. We have people that come in here with fibromyalgia, peripheral neuropathy, huge part of our practice, both of them, dizziness, vertigo, migraine, all kinds of neurological problems. Dr. Gates is a board certified chiropractic functional neurologist. As a result, a lot of our practice leans towards neurological problems. And so a lot of folks are coming in here after they've done everything else. They've been everywhere. They've tried everything, and we're generally the last stop. It's not uncommon for someone to come in here and be on 5 or 10, or we've seen people on 15 medications. And usually by this time they're on pain meds, and usually by this time they're on pain management, which in the medical world means we're done with trying to figure out what's wrong. We're going to manage your pain for the rest of your life. And now what we're seeing is very, very, very regularly is I'm doing the marijuana, like I'm going to slap him or something, It's like, okay, I get it. It's there. And there are people who come in and they're like, and it helps me, like, good. I like it. It's probably better than opium, or stuff like that. So we're going to put that in perspective for those people, at least who are interested in coming here. It's a drug. There's parts of it that has its benefits. There are certain types of conditions that it's very beneficial for. There are other conditions we haven't seen, and the literature indicates it's not that. It hasn't been shown to be that successful for. And just for the record, in our world, when people come in here on drugs, or they come in here on supplements or herbs that are working for them, we don't say stop taking them. Mm-hmm. We say keep on taking them. Our goal is to get you down off as many drugs and as many supplements as possible. Get your condition under control. We do mostly autoimmune and neurological problems. And I might even flip that now and say more neurological problems than autoimmune, but usually there's some combination of those. And so we have an opportunity to see what works in these types of conditions. And our goal is to get that patient condition under control, stop it from declining, reverse it to the degree it can be reversed, and get them off of as many drugs and as many supplements as possible. That doesn't mean we're like a never drug type of group. I mean, if there's a point where your physiology is to a point where it just isn't going to make it all the way, then medication might be involved. And so we do have a lot of conversants. We're not medical doctors. We work with medical doctors, but we do have a lot of conversants with this subject. So is that our experience with chronic pain? Did I just summarize that by accident?
Fantastic. That was really good.
Okay, thanks. Well, I do all the intakes and I do all the consults. I share the examination duties. So I get kind of the raw questions coming in, like the unfiltered, like, why do you think you know what you're doing? Type of, what makes you think you can help me when those types of things. And it's really Dr. Gates who does all of the treatment now, and the vast majority of the exam. But still, it's important to really understand what's going on with that patient, and these are the things that I'm hearing every day in there to kind of say, yeah, we can help you. No, we can't help you. Yes, it's okay that you're taking, cannabidiol. No, marijuana may not, blah, blah, blah.
Mhm.
So
I would just highlight one other thing, and
Go.
you say this, but I'll just maybe
I mean,
emphasize it a
I'm
little
pretty
bit.
much almost done for the whole thing here.
In our view of chronic pain, we're looking at factors such as stress and anxiety and post-traumatic stress in incredible detail. We're looking at, in terms of bacterial alterations in the gut, we're looking at small fiber neuropathy where the pain nerves start to die and degenerate, and all these different factors that come together to cause someone to have chronic pain. And we address each of those individually, but also within an organized treatment fashion. And that's just an example, because in the chronic pain umbrella, I mean, there's chronic lower back pain that's included in that umbrella. And then we have fibromyalgia, then we have multiple sclerosis, and we have rheumatoid arthritis. So all these different conditions are put under there. So sometimes it's hard to kind of, say exactly what we do. Sometimes it's easier to explain what we do for each condition, but that's kind of a general outline. And then we have the marijuana model now, which is very analogous to a supplement or a pharmacological model where you take the marijuana, cannabidiol, THC, take it together for XYZ condition. And so now they're studying that one treatment for these conditions, looking at the potential outcome, which is really different from our model. So I just wanted to kind of illuminate that a little more.
Right.
Yeah.
And so we have people that come in for whom it's very successful in helping them with certain symptoms, and we have other people who come in and it isn't successful, and it seems to go back to maybe this is getting, I don't know, maybe this is going to be helpful, maybe it's not, but as people who are interested in this from a clinical perspective, the promotion of marijuana out there has been as medical marijuana. Now, I will say that the marijuana dispensaries that are popping up here they have menus. You can go in there and it says, well, this one will make you a little high, and this one will do this, and this one will do that. And indeed, there is a aspect of marijuana that can be very beneficial for inflammation. And there are a lot of other aspects of marijuana that aren't doing anything. Although people might say, well, it makes me feel better, and maybe that helps their depression and stuff. And we're not, I didn't see that we were going to talk about that.
We're not going to go into psychiatric today. I think we're going to save that for
okay. So we'll do another one on that. So we're going to talk strictly about the inflammatory component of it and where that works. And I'm going to take that one step back to, it's been a while now that people have understood that inflammation is an issue, if not the issue. But the question, and inflammation is a natural response in the body to everything, to injury, to stress, to just about anything you can imagine. And most of the processes that Dr. Gates talked about create inflammation. If you have high blood sugar, you got inflammation. If you have low blood sugar, you have inflammation. Too much iron, inflammation. Too little iron, it's all about inflammation. So we had and still do, had a culture of natural anti-inflammatories, which are the juices I'm thinking about.
Okay.
And then we have turmeric, and then we have all of these types of things. So the concept of dampening inflammation has been around now for quite some time, and the approaches seem to be getting more and more maybe focused, or maybe made more powerful, and this may be a part of that in a sense of that ongoing flow of handling information. On the other hand, it is presented currently, maybe for marketing or whatever, as really kind of managing almost everything. And so we're just going to kind of tease that out for you based on what the research says, but also based on what we see here. So
yeah, and I kind of want to touch on that last point, because a lot of people, there's almost like a backlash going on, and we're not criticizing them. I'm just going to talk about it. You have all these people who are promoting marijuana through the ages, from Native Americans to the hippie generation. Sorry, I'm not using that in a pejorative connotation, but yeah, the 60s movement.
I was around then. He was born then.
I was not. He's been in practice longer than I've been alive, which is pretty awesome. But you have that whole movement where they've been using marijuana for a long time, experiencing certain benefits. And then we have the whole drug war going on. And so there's this kind of this epic battle. And now marijuana is gaining credence not only in the literature, but it's accepted now. And so now it's almost like this drug that's good for everything. And so we're not saying it's not good for everything, but it's just very early on in the literature where people are starting to study it. So we can't really say it's good for everything yet.
But there are areas where it is clearly beneficial.
Exactly. And that's what we're going to talk about now. So specifically, the studies say that marijuana is beneficial for MS patients as it relates to their spasticity. Multiple sclerosis, hopefully you know, is a condition where basically you lose the insulation around the nerves in the brain and the spinal cord, and then that can result in trouble moving, difficult contractions of muscles, to incontinence, to depression, to balance issues, to vertigo. I mean, pretty much any neurological symptom that can happen in the brain, the spinal cord, can happen with MS. And so it's a very big deal that they found that the marijuana, the cannabis in this situation helps with the spasticity. That's pretty profound. And they're actually finding that the THC has a big benefit for these patients. So everybody's always looking at THC versus cannabidiol now in the literature. THC is more the psychoactive component. Cannabidiol is more the anti-inflammatory component, but they're finding that the THC helps with the spasticity for MS patients.
Cannabidiol is the oil.
The oil.
The oil.
And so now, just let's talk about it. There are corporate pharmaceutical interests in this area. So now they're making new patented formulas, certain ratios in Europe, particularly of THC to cannabidiol to treat these MS-related symptoms. So probably a lot of you are aware of that, but maybe not all of you. And then we know that for a long time, really where it started being used medically is basically THC for things like nausea for chemotherapy patients. And now they're using cannabidiol and THC for pain associated with chemotherapy. And they're finding that it absolutely can have significant benefits in that regard. In addition, for neuropathic pain, so basically that means nerve pain, cannabidiol and THC are showing to be effective. So that's really well and good. One of the interesting things we found this morning in going through all the reference studies was that there was no significant benefit for using THC and cannabidiol for chronic pain associated with rheumatoid arthritis or fibromyalgia. That's important for us because we treat a lot of patients who have those disorders. And so that's kind of important to highlight at this juncture as well. I also want to note that in some of the studies, for those of you out there who are big marijuana promoters, some of the studies were not, even though there was a benefit, so they compared marijuana in the form of THC and cannabidiol to placebo, so a sugar pill. Though it helped with chronic pain, some of the results in the literature were not exactly striking. So there was a benefit, but it wasn't like this overwhelming, like, oh my gosh, we have the complete cure to chronic pain. So it helps, as Dr. Rutherford says, that's what we've seen for patients, from patients who come in and talk to us about it. But again, there are many factors involved with the chronic pain process, including inflammation, including the spinal cord and brain learning the pain becoming based in the brain, how stress factors influence pain, as well as how dietary factors are really important. And not only we are what we eat, so if you hurt your lower back and you've been eating nothing but crap, well, your cell membranes are basically made of crap, specifically inflammatory fats.
And inflammatory, I was going to say, and inflammatory.
And these inflammatory fats cause a bunch of they cause a cascade of inflammatory signals that may cause your pain to be significantly worse than if you're eating a non-inflammatory diet. Or your gut bacteria, for example, we're finding they have huge influence on inflammation. And we see changes in people's pain by changing their guts. So keep all this in mind, okay? Marijuana is one piece of the puzzle. We're not knocking it. We're not saying it's the only thing, but this is the data.
Oh, we're just trying to give you the data to give a little more clarity. What Dr. Gates was saying there at the end is, we've seen people respond to turmeric and not, or curcumin or not. We've seen people respond to the variety of different berry juices and the noni juices and those types of things, or not. the or nots, it's easy to explain to them why, because there are so many other things. Their inflammation has been there for so long, it's just overwhelming. That is just not powerful enough to take it. But even for the people who respond, the mechanisms that are creating the inflammation are still there. So if you have high blood sugar, low blood sugar, you have a lot of stress hormones, you have a bad gut, you have food allergies, and you're drinking this juice and it makes you feel better, keep drinking it. But really, particularly if you have brain fog, particularly if you have short-term memory loss, these types of things, these get to the point where they can be irreversible because brain cells don't replace themselves once they get going. So our viewpoint is, I know this is helping you, but we really need to figure out what it is that's causing your inflammation. So in the beginning, when Dr. Gates says the cannabidiol oil is kind of in the same category with all these inflammatories that we talk about, that's what he's talking about. So so it has its benefits in the areas that Dr. Gates just outlined to you. That's what's been outlined in the research. It does correlate with what we see here in results relative to patients. And so we just wanted to help to tease that out for you. And it's I think even me, so I went to college in the 60s, right? Like I was going to college in like the late 60s through like the mid 70s, like the part of the totally, most, it was still evolving and there weren't laws about it. And I mean, if you walked into my college dormitory, if you didn't like the smell of marijuana, you would need to put on a gas mask or something like that. So, I mean, it was very widely used back then. And I think that confusion, that social confusion of still like, you see these places popping up now and it's legal and you can walk in and they have a menu. I think that creates some of the confusion as to the questions that I get when people are walking in. So we're just trying to bring you hardcore data that it's another drug now in the pharmacopoeia. They're still trying to figure out everything that it works for, but this is what we've seen. And Dr. Gates just wanted to share that with you this morning.
Yep.
Okay.
Well summarized.
All righty.
So we're going to have articles attached to this broadcast on powerhealthtalk.com. We had some server issues, but hopefully they'll be up there later today. So if you want to look at those articles, go to powerhealthtalk.com. And if you have any other questions or comments, send those to us on Power Health Talk. And we'll be back next week with an exciting topic. So, see you later.
Bye-bye.